Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science, Coimbatore. Today we are going to discuss a topic on functions of kidney and the normal urine output. Define. In define part, we will be seeing about the normal kidney function. The kidney or the bean-shaped organs present on the retroperitoneal region. The functions of kidney is to filter the blood and remove the waste from the body. Our kidney has a functional unit called as nephron. There are millions of nephron in each kidney which helps the filtration process. Actually, what is the functions of kidney has been described in the slide. You can see that is filtration, reabsorption, secretion, excretion and the regulation. What is happening in filtration is the blood has been entered into the glomerulus part of the kidney where the blood and the waste products and the fluids has been removed. Almost 180 liter of the fluid has been removed by the glomerulus. What is happening in reabsorption? The tubules which are helpful for reabsorbing the electrolytes from the waste. So the electrolytes has been reabsorbed to the body. The electrolytes are water, glucose and ions. About 99% of the electrolyte have been reabsorbed, which is essential for the human body. And the secretion. The waste has been secretion from the blood into the tubule part for the excretory process. Final one is excretion, where the urine has been excreted from the body. What is contained in the urine is the waste products, ions. If you take drugs and the drugs, everything has been removed in the urine. What is the other function of a kidney other than creating an urine is regulation. Our body is maintaining a fluid level which is very important. It is regulated by the kidney. Maintaining an acid-base balance, maintaining an erythropoietin hormone for regulation of the RBC production, and renin angiotensin mechanism, which is the main mechanism for regulation of the BP, and it is a long-term mechanism. All this has been taken over by the kidney. Hope you know what is kidney is and what is the functions of kidney through this slide. So what is the normal urine output that we go in a day? Keep in mind that the water intake is very much important for getting out an urine. So for the normal urine output is almost 800 to 1200 ml of urine has been removed from our body daily. That too depends upon the intake of water. What is the composition of urine? It is about 95% of water and 5% of the solutes. The solutes are urea, creatinine, blood urea, nitrogen and the electrolytes. All these together can be removed from the urine. So in empathize part, I want to tell you why the kidney function is important. As a layman, we doesn't know what is the function of kidney is. Now we can understand the functions of kidney. Everybody will have a doubt whether we are a normal or a healthy person or we have a disease. Once you get an age, then you know about the failure of the kidney. So this is about formation of kidney stones, infection or reduced urine output. These are some symptoms and the pain the patient feels. They will have a less urine output, they will have a pain. Then the patient goes to a clinician. What the clinician will do? He want to assess the functions of kidney through various diagnostic tests. So what is an ultimate reason for doing this is either the kidney functions normally and it maintains the homeostasis and the urine output. This mainly done with the help of GFR. GFR is the amount of the filtrate which is removed from the blood. It is about 90 to 120 ml per minute is per meter square. This GFR rate determines the amount of urine that has been removed and the waste that has been removed from the blood. So, I want to drink more water. What can I do? But I don't have a time or else I forgot to drink a water. That leads to a kidney damage or a kidney failure. I was very afraid of it. What shall I do? I want to have some app with me which is a main ideate part. So you can track your urine output and the hydration with the help of app. It will give you a reminder to take out the water. It will boost up to intake of the water, will help you to have an power to maintain the urine output. So to understand more about the kidney function, I am here to present a case study. A 64-year male patient who have a severe breathlessness and a decreased urine output, loss of appetite and the bilateral leg swelling and weakness. He have an hypertension of 3 years. On examination, his BP was also elevated and his GFR rate is drastically reduced to 15 ml per minute per meter square, indicating that he is under a kidney failure and he is also a chronic stage of kidney failure. So you can see in the image that is 0 to 5% of your GFR rate indicates a kidney failure and 20 to 55% that indicates a kidney disease, and more than 60 it's considered as a normal. So what is an interpretation that we can do, and to what is the treatment that you can provide to the patient with the above case study? The case study itself revealed the patient is having a kidney failure of 5th stage, and he has a decreased urine output and his BP is not maintaining. That says that his kidney function is totally abnormal, because the renin angiotensin mechanism is drastically reduced here, so that his BP is also getting elevated. So decreased urine output is the main cause, and the treatment what we can give for this patient is an end stage treatment that we can go for an dialysis. Dialysis is an artificial kidney function. We are providing through a machine. We are removing the waste from their body with this technique. Hope you have understood what is the functions of kidney here. So it's a simple assessment. So what is the functions of the glomerulus in the nephron? Primary function is to filter the blood. What is the daily urine output? It is about 800 to 2000 ml per day. What is oliguria is? It indicates about the 400 ml per day is a value of urine that the patient is going off, and it can be a possible kidney function dysfunction. Thank you.